Hi. I'm robo-Suzie, and today I'll talk to you about why do varicose veins form and what can you do about them during pregnancy. Also, don't forget to check out the link below, to find out how I got rid of varicose veins fast and easy. I didn't believe it at first. But back to our topic. Developing or worsening of varicose veins during pregnancy is not uncommon, and for many women are problematic as a result of the discomfort they cause and their appearance. This article is being written to help explain why varicose veins develop and some measures that can be taken to deal with this problem. Though one's predisposition to developing varicose veins during pregnancy is unavoidable, there are some simple measures one can take to help minimize the problem, which impacts both men and women. Varicose veins in the legs is only one manifestation of pregnancy-related vascular changes. Hemorrhoids, prominent vascular changes on the abdomen, around the navel, and vulvar varicosities are other changes in the venous vascular system during pregnancy. Blood volume increases during pregnancy, and the stasis of blood leads not only causes varicose veins but also the swelling often seen in the ankles due to increased fluid shifts into the tissues. These changes are the result of both physiologic and anatomical changes during pregnancy. There are a few simple suggestions that can help alleviate the discomfort and overall severity of varicose veins. The suggestions I will make are worth considering as they are based on fundamentally sound scientific principles and certainly are not harmful. The best example I can think of, to help explain why varicose veins form, is to draw an analogy to when you have your blood drawn. When a tourniquet is placed on your arm to draw blood, notice that it is not as tight as a blood pressure cuff. The reason for this is because the purpose of applying a tourniquet is to obstruct the return of blood to the heart, thus distending the veins, which is a low pressure system. The pressure from a tourniquet is just tight enough to block the blood flowing through the veins, causing them to become distended. On the other hand, when a blood pressure cuff is applied, the pressure applied is much higher. This is because the goal to obtain a blood pressure reading is to determine the highest pressure required to obstruct the arterial system. Here are some simple suggestions. 1. Do not cross your legs when sitting. This is something many people have been told and is particularly significant when done prolonged periods of time. The reason crossing one's legs can impact what is called venous stasis, is impaired blood flow up the legs, not to mention the force of gravity. Whether or not leg crossing contributes to the exacerbation of varicose veins, I can assure you it definitely does nothing good when it comes to varicose veins and swelling of the lower extremities. 2. During prolonged trips in your car or by plane, make an effort to frequently stand and exercise your legs, as this causes muscles in the legs to contract, which is what facilitates the return of blood to the heart. Furthermore, the pooling of blood in the lower extremities can also contribute to the development of blood clots. The airline industry recognizes this risk, and you may have noticed that they do make suggestions to prevent problems with phlebitis on long flights. Another example of the importance of muscular contractions to return blood to the heart is the often told story of military personnel fainting when standing at attention for prolonged periods of time. Muscular contractions and venous system valves are what keep venous blood flow moving in the right direction. 3. Elevate your legs whenever possible to counteract the forces of gravity, as previously mentioned, and possibly help prevent varicose veins during pregnancy. As I will discuss in future articles, gravity alone contributes to the swelling, edema, in the legs, ankles. 4. Lastly, consider compression stockings to help keep the appropriate pressure on superficial veins, which are part of the low pressure venous circulation. This will also help reduce swelling from fluid retention while you are upright during the day. It is absolutely essential that you discuss the use of stockings, jobst, TEDs, etc., with your provider and use stockings that are the appropriate pressure and fit properly. In severe cases of varicose veins, there are stockings produced by medical supply companies which are actually measured and ordered by your provider. Do not to use ankle or thigh-high stockings that have constrictive bands or that are tied at the top, as they will act like a tourniquet, see above, and can make matters worse. Use full-length stockings whenever possible and check them out first with your healthcare provider. Women, after their pregnancy, and men who have severe, symptomatic varicose veins may consider treatment at some point in their lives. Stripping veins, sclerosing, laser, etc. If you pursue a treatment for varicose veins, be sure to do your research and consult with specialists who regularly treat varicose veins and are familiar with the best and safest approach to this problem. I say this because the management of many medical problems is changing at a rapid pace due to advances in technology. This article is only intended to help women understand why varicose veins develop and suggest some efforts that can be made to help prevent their progression. I cannot comment on the management or complications resulting from various modes of treating varicose veins. This can only be addressed with your provider, who can evaluate your clinical findings and medical history and decide on the best treatment approach, most often after your pregnancy. If you ever notice any redness, tenderness, warmth or swelling associated with varicose veins, you should immediately bring these concerns to the attention of your healthcare provider, as these symptoms can be related to a more serious condition called thrombophlebitis, where there is inflammation of the veins and lead to other problems, blood clotting, etc. Again, the diagnosis of such a condition can only be carried out by your personal provider. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.